If you own a business with under 50 employees in America today, there's a legal loophole that you can use that will literally wipe out premiums for your employees, the spouses, and their kids, and you can become a magnet for top talent without spending one dime more than you're spending right now. If that's you, you're in the right place. Most people don't know this, but 66% of American bankruptcies are healthcare related, and 75% of those people had health insurance. I want to test what you know about what caused all this. True or false? The normal broker distribution channel is connected to insurance companies, and those brokers are contracted to serve their interest, not yours. That answer is true. You see, if we would take a 40-employee company, that's what this illustration shows, a broker earns commissions between $30 and $50 per employee per month on a group plan. That pencils out to a little over $14,000 annually if the broker got paid $30 per employee per month on that 40-employee group plan. Commissions for brokers who sell individual insurance are between $10 and $20 per employee per month. But the truth of the matter is that group brokers just need to sell one contract to one employer, and they get paid this much for that group commission. Individual brokers would need to enroll 40 employees separately and their families, and that is a lot more work. So I'm asking you, what would you sell if you were a broker? True or false? As a responsible employer, you must purchase a group health insurance plan to provide compliant benefits to your employees. That answer is false. This is a myth. Group health plans are only one way to provide compliant employee health benefits. The truth is that a law was passed back on January 1st of 2020 that allows employees to own their own coverage and also allows employers to legally reimburse their employees tax-free. There is no group contract required, and it's completely compliant. And a little known fact at the bottom here is that the highest margin products offered by health insurance companies happen to be employer-owned group insurance plans. True or false? Individual health insurance plans are more expensive compared to employer-owned group insurance plans. That is most definitely false. In fact, individual health insurance is 40 to 80% less expensive under Revival Health, and that is true in all 50 states. You see, individual health insurance can be purchased at either retail prices or you can get it at discount prices, which I'll talk about in a second. But according to ChatGPT, 50 to 55% of all Americans are eligible for these discounted priced individual health insurance all across the United States. How can this be? Well, in 2026, individual health insurance costs are capped at just under 10% of an employee's household incomes. A single eligibility for anybody earning less than $60,240 is eligible for these discounts, and any family earning $124,800 or less is also eligible for these discounts. So let's see what this looks like. A single person earning $50,000 would pay a premium rate of $415 because $50,000 times about 10% is $415 a month. Now, if you're a young person that's 20 years old under a group plan, you may be paying less than this $415. You might be paying $250 or $300. But if you're a 40-year-old, you're paying $650 to $700 a month. And if you're a 60-year-old on a group insurance plan, you're paying $900 to $1,100 a month, depending upon what kind of plan you have at your employer. Under this law, you cannot pay more than 10% of your premiums to an insurance company on an individual plan. So whether you're 40, 50, 60 years old, that premium is $415 for you under Revival Health. And the family is the biggest benefit. So a family earning $100,000, which average on a group insurance plan in America about $2,100 monthly for group insurance, pays $830 a month because 10% of $100,000 calculates out to $830. So under Revival Health, we not only allow individuals to own their own coverage, we also make sure that they're eligible for those discounted rates on individual health insurance. But a little known fact is if you are an employer and you own a health insurance plan right now in America, you are locking out your employees from receiving these employee-owned discounts. True or false? Employees must answer medical questions and pass underwriting to get individual health coverage. That answer is false. Under the Affordable Care Act, or ACA guaranteed issue, all health insurance companies are prohibited from asking any medical questions by law. Pre-existing conditions are covered. The same basic protection as group plans without the group plan price tag. You see, healthcare in America is the second or third largest expense item on a profit and loss statement with most companies. And they have a program that you're likely under right now if you are owning a group insurance plan in America, where they lump you all together in this system. So you probably know this story. If you come to the end of the year and you find out from your broker that an employee had cancer or an employee was on dialysis and maybe another employee just had a premature baby and that baby was in the hospital under 24/7 care, which is, by the way, on average about $1 million claim, that all comes back to your company and your employees. So when your broker delivers your renewal and your health insurance is going up 6 or 16%, that goes up for all employees all at once. Here's an example of a manufacturing company of 40 employees with a 60-year-old earning $50,000, a single gal with 2 kids earning $75,000, and a family of 5 earning $100,000. Now, if we take a traditional employer-owned Blue Cross Blue Shield $2,800 deductible plan and we compare that with the individual plans at retail prices or the individual plans at discounted prices, here's what those employees would be paying on your group. $995 for that 60-year-old, $1,284 a month for that single gal with 2 kids, and $2,100 plus for a family of 5. Now, you can buy health insurance on the individual market at these retail prices, but why would you buy an individual plan that is the same deductible, the same Blue Cross plan, everything being the same? Why would you not want your employees to get that 60-year-old coverage at $415, or that single gal with 2 kids at $623, or that family of 5 at $830 a month? Remember, there's no health questions asked by law for individual health insurance, and according to state laws, you cannot pay more than about 10% of your household income towards that health coverage. So here's what Revival Health attempts to do with each of our groups. This is an example of a 40-employee group paying $600,000 in total premium, where the employer is paying $400,000 of that $600,000, and the employees are paying $200,000 through payroll deductions. Now, the overall goal is to reduce the overall costs, and in this particular case, this employer wanted to lower employees' premiums as much as possible. So we took that $600,000 and we reduced down that cost through Revival Health in half to $300,000. Now, the employer before was paying $400,000. In this particular case, if the employer is willing to pay exactly the same that they were before, they have a guaranteed flat budget for their business because they are money providers under Revival Health. You don't get involved in that lump you all together claims mess that I talked about before. But in this particular case, that employer can wipe out premiums for employees and their dependents, if that's what they choose to do, and have $100,000 left that can go to their bottom line. Now, each employer is going to have a choice as far as how they manage and how they redeploy their employer dollars. This one wanted to keep it the same and a flat budget. You could take that $100,000 and instead of putting that to your bottom line, you could put $2,000 into each employee's HSA plans on their behalf and help them with their deductibles for all of those employees. Your choice is clear, whatever you want to have happen here. True or false? Switching away from a traditional group health plan means firing your broker and disrupting your entire benefit structure. That is false. With Revival Health, you can keep your broker relationship. In fact, many businesses maintain their broker for benefit advice and service while shifting health insurance to our direct purchase model. You see, this isn't about eliminating relationships. It's about eliminating the status quo system, the system that's crushing businesses, and replacing it with a sensible system, one that benefits both you and your employees, and brokers can be compensated under our Revival Health program. So here's a quick recap. Health insurance companies' highest margin products are fully insured employer-owned group plans. They want those plans to be sold by brokers around the United States. You don't need a group health insurance contract to be compliant. Individual plans can be cheaper and offer a lot more choice than group insurance plans, and the employees choose, not you. There are no medical questions that are required for employees to apply by law, and switching away from a traditional group insurance plan doesn't mean firing your broker. The old traditional system is designed to keep you in the dark, and we're changing all of that with Revival Health. But under this new system that we put together, we wanted it to function and to be as easy to administer as possible. So Revival Health functions just like your group insurance plan, but under this new system, it actually works for you and your employees. How it works is you pay one premium, and instead of paying it to your insurance carrier, you pay it to our administrator. They collect one consolidated invoice each month. The administrator pays the carriers on behalf of the employees electronically each and every month. And if you do require or want your employees to have some skin in the game, you are also going to get that payroll deduction file like you used to on your group insurance plan. So HR receives that file for your employees' portions that come out automatically out of their paychecks. But I need you to recognize something, and this is pretty easy. But if you check just 3 of these boxes out of the 6, you are guaranteed trapped in the system. Have your premiums increased at least 3 out of the last 5 years? Do your employees complain about their high deductibles or narrow networks? Have you ever heard this one before? Why do we even have insurance anyway? Over my career of 28 years managing my own brokerage firm, I heard that over and over again. Have you switched plans or even switched brokers, hoping for better results, and still been disappointed? Do you find yourself spending more time on benefits administration and trying to guess how bad your claims are going to be at the end of the year, hoping to God your premiums don't go way up? Are you forced to choose between cost and coverage quality? And are you bracing for these increases with some mystery and dread, not knowing what next year holds and whether or not you can give your employees raises even? Why listen to me? I spent 32 years inside the traditional health insurance industry. I built and ran a successful brokerage firm for 28 of those 32 years. I sold my brokerage firm in 2023 because I wanted to serve employers and their employees. I actually wrote a book that came out in 2021 called Health Insurance Sucks: The Moral Case for Better Business Healthcare, because I want business owners and their employees to get the truth. And that's what I'm here to do from this point forward. Now, lastly, I want to make this personal for a second. What results do you want for your company? Have you ever been asked if you want to reduce or eliminate the premiums for your employees and their families? Have you ever been asked, do you want to help your employees with their deductible costs? I'm guessing most of you haven't been asked those questions before because you didn't even know that it was possible. Well, I'm here to tell you with Revival Health, all of this is possible. So all we're asking for is a small investment of your time. We are going to be running a series of free live webinars, which will cover the design, education, administration, enrollments, and compliance of Revival Health. Every attendee will receive a free Revival Health calculator that you'll be able to take back and determine just how much in savings you have for you and your employees. This is going to be primarily focused on companies under 50 in size, but I am going to take some time to address the mid-sized companies of over 50 employees because Revival Health works in that environment as well. And remember, this is a direct purchase model. You can keep your broker if you want. This gets you out of the business of healthcare. No longer will you be in that lump you all together system where the claims of 1 or 2 people in your group affect everybody in the future. And you will walk away with everything you need to make an informed decision whether you work with us further or not. Thank you so much for attending this webinar today, and I'll look forward to seeing you on the other side in one of our free live webinars. Thanks so much.